Okay, so we have a lovely lady today, came all the way from Maryland, and she's already been here one more time, once before. So, this nice lady has a long upper lip. She wants to lift it up to have more of a vermilion. So, it's tricky because we already did the alarplasty. So, it's important to give a gap in between, and it's ideal to give a 1-year gap. Try not to do less than 1 year because the vascularity is not back as yet. So that's one. Second, she has a chin that's from the side view sticks. It has like a witch's chin appearance where it's like soft tissue, a little too much soft tissue. It looks squarish as well, so it's a little tricky, but we have to try to bring it in. It's not just pulling it back this way, but from the sides as well, pulling it in. So we'll excise a little skin, maybe take some mentalis out, not a lot, and then give her the little point that she wants without having the chin that she has. Okay, let's take a look and we'll show you. Okay, so you can see that, the lip is not bad, but with time it only gets longer and longer. So we need to make a nice change in that area, that we will. Now I'm gonna have her put her chin down a tiny bit so you can appreciate the appearance. So this is the issue right here and here. I'll show you from the side. Extends, yep, it's sticking out. Now we want to bring it in, and she asked if we could do it where this goes in as well from the sides. So from the sides goes in and pull in. So we'll have to make almost like a manta ray type incision, like like a stingray, manta ray, underneath the chin, and pull differentially from in here and in here. And I'll show you during surgery to how to pull that in. Very tricky because you can end up with dog ears on the sides, so you have to be careful. And I will remove some of the mentalis in the center and some soft tissue, any fat and stuff that I see, so we can really reduce it. And we'll get started soon. Okay, so let's go over exactly what I have done. I would like you to come closer to watch it. And first we drew the bullhorn, the lip lift area. And if you can come closer and make sure that all you see is just this area. You want a really nice close-up camera because you're going to be held accountable. There you go. See, Kim is very good at it. So right here, you can see we went right at the very close to the base of the columella, the nasolabial angle, following it all the way, going all the way along the sill. And right here, now it's going into the old alarplasty incision right here. Same on this side. It's following here, but still is okay. Right close to this area is going into the old alarplasty incision, and that's why you should probably, actually in my humble opinion, never do alarplasty and lip lift together. And if you're going to do two, I like to separate them by 1 year to make sure the vascularity is back to be where it needs to be. And if you notice, I've taken a little extra hair because what I find is that you always get a little nice pull here. This does not get enough pull, so with this it'll get a nice pull. Now we go to the chin problem. So we are excising skin as well. As you can see, initially I marked very little on the sides, but remember, these need to be pulled inwards from the sides this way. So I made it a little wider angle right there. It's almost like 45 as opposed to the typical 30 on both sides. And when I start closing, I'll have to make sure I start from the sides and then use either the halving principle where you do the halves and close it, or if I have to push come to shove, have a little vertical closure right here. Doesn't matter, nobody can see, but that's going to be the key. Very good, ready to rock and roll. Okay, very excited. We're all done. Lots of hard work, but it paid off. So that you can see the lip already changed. The lip looks fantastic, and the incision is closed very nicely. It should heal beautifully. And then look at the chin, and the chin is tucked in very nicely. And we go below and we show you right there. We got a good amount of skin, so guess what? Now look at that. Not only the chin, the neck as well. Looks just beautiful. It's great. I'm very happy, and hopefully we'll get some pictures from her. She is good about that, so I'm hoping. If you're all set, keep you posted.